I'm Shauntel, Leeson, and welcome to Money Talk Viewpoint. We are the online talk show and podcast for financial professionals who specialize in working with high net worth, ultra high net worth, family-owned businesses and family offices. We have a panel discussion. This is our first of our panel discussion series. We'd like for you to consider joining us in the future, and we'll put out a message on LinkedIn and Facebook if you're interested in our discussion topics and to be able to join us. So I'm going to kick it in gear. Introduce yourselves one by one, starting with you, Mary. And introduce yourself and tell them what you do.
I'm Elaine Petrucci, and I work with family caregivers, coaches, and holistic practitioners in terms of reducing their stress, overwhelm, and burnout using mind-body programs and hypnosis training.
Katie?
I'm Katie Pfisterer. So we have our own insurance company, Pfisterer Retirement Insurance. So we do health and life insurance for different ages, but our primary focus is on Medicare. And so we also provide additional plans, long-term care plans, and other things for the age group as well.
And Katie is a partner that will come on in a few minutes. He's coming on, right?
Yes.
Okay. And the next person is actually my co-host. This is Dennis Williams. Dennis, how are you?
I'm doing well. Thanks much. And my background's primarily been in healthcare and finance, and recently launched CashMap Consulting, which is focused on strengthening family finances, whether it be boosting credit score and eliminating debt or paying less interest on what you end up paying, and just bringing clarity to your finances. And just a pleasure to be here.
Hi, and thank you. And I was hiding. You found me. So I'm John Pfisterer. I'm with the Pfisterer Retirement and Insurance, and my wife over there that you saw. Well, we're a family practice, and we've been doing Medicare, Social Security, and retirement assistance for free for families and individuals for the last 6-7 years out of the Chicagoland area.
So, the factor is that when somebody's going through a long-term care problem, the people that are there to take care of them, it impacts their lives equally. And if you are, and oftentimes it's a family member, usually it's a female family member who steps down from her career to take care of whoever it is that needs help in the family. Dennis, you have really built programs around long-term care. Can you share with us some of the things that you've noticed or what you've been able to help people to do or address that issue of long-term care?
Well, I think there are really a couple of issues that I'd like to bring up at this particular point. Number one, nobody likes to think about themselves even being in this situation. And so a good part of the challenge that certainly that Jonathan and Katie run into, as well as what Mary is assisting people with, is really the challenge of when people are finding themselves in a situation that they didn't actually think or plan for going forward. So you've got everybody now in a crisis mode. So let's just kind of take a step back. Most people don't think that they're ever going to have any cognitive issues. I can think of a case while I was CFO at a hospital in Hawaii, of a young lady on her way for her final defending her PhD, her thesis, 34 years old, gotten into a car accident, head trauma, and now she will be there the rest of her life because of the subsequent behavior issues that have come out because of that trauma. So one of the things to consider is there's a higher probability of someone becoming disabled than they are of dying. And so when you think about a disability, you may have disability coverage to deal with income. But if you're finding yourself needing long-term care services because you can't do the activities of daily living anymore, health coverage, medical plans don't cover that. And so the idea of, everybody waits till they're in their 55 plus, but there is that possibility that someone's going to need it sooner. And of course, the younger you are, the cheaper the rates are. as far as being able to provide that coverage. So that's number one. Number two that comes into mind is that, you know, if you begin to think down this road and ask the question, the individuals in your circle, how competent are they and how comfortable are you with just trusting them to do the right thing? And to, because I've also seen that where someone will have what we call an indemnity product in long-term care, which means they just give you all the money so you can spend it the way you want, thinking you're still going to have cognitive skills. But if you haven't thought, what happens if I don't have it anymore? And therefore I don't have the ability to manage this money. Who would I want to kind of be that backup for me to make sure that this bunch of dollars that now comes in is going to be spent appropriately and not be whittled away, which is one of the advantages of a long-term care product. It was what they call reimbursement, because the long-term care plan requires there to be particular parameters met before they're going to pay for a service. So again, the key item that I'm bringing up here is think about what approach you are going to want to take if you no longer have the cognitive ability to direct your own care. And who do you want to have speaking for you that you know you can trust?
Let me ask a question. I hope I'm not stepping in the wrong territory here. Let's say it's not a person in the family. Is that something that the legal issues, is that a legal issue that they have that included in their trust or living trust or something of that nature? Or are you able to address that issue, Dennis or Mary?
Yeah. Well,
Or any one of you?
Mary, I'll let you go first.
Thank you.
Full screen.
My concern, as everyone has said, is really preparing like all the legal medical insurance forms before something happens. So you either have to have like a durable power of attorney, a medical power of attorney, you need a living trust, or at least a will stating who you want to help you with your finances or your medical care. So you need things like a living will or advance directives so that people know specifically what your wishes are. And they need to be done as soon as possible so that because like Dennis said, with that 34-year-old PhD student, you never know when something might occur, and you may not have that ability to really have the cognitive wherewithal to really tell people what you want, who you want to represent you with your medical needs or your financial needs. So any way that people can, as young as, late teens, early 20s, come up with at least some kind of a will and get like all of their medical, financial, and legal documents in place should anything happen.
I'm going to say, you mentioned late teens, early 20s. They're not even thinking at that level.
No, they're not.
And then I think unless and because I have a 22-year-old daughter, and I can tell you right now, her mind's on one thing. She's traveling the world, and that's all she's thinking about. But I would say that from a realistic perspective, is it more like when they're in the workplace, somewhere about middle 20s and later on, we should be focusing on, and this is something that they prepare from at work in the HR department, or is this up to the individual to figure it out what to do?
I think HR departments are helpful. Let me give you share an example like Dennis did. I worked for a neuro rehabilitation company, so we provided coma stimulation, psychosocial programs, community reentry programs, and acute and coma stim programs. And there was a young person that went on vacation and experienced a near drowning, and now he was going to have to be on state Medicaid because he chose not to sign those health benefits. And I guess he had the forms in his desk in a drawer at work. And now there is nothing he can do about changing the circumstances, because now you're looking